Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, get peace of mind, real power, real control, and so that you can influence decision making fast even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was, my mum had a cardiac arrest at home and the ICU doctors are telling me she has brain injury. Can she recover? You can check out last week's question by clicking on the link below this video. In today's episode of Your Questions Answered, I want to answer questions that we get quite frequently as part of my one-on-one consulting and advocacy service. So today's question is, can doctors in intensive care push you to take family members off life support? So let's look at this in more detail. Having someone you love critically ill in ICU is one of the things we most dread of. The part that we are most afraid of is when the doctor comes up and says, your loved one is too critically ill that he or she will not be able to have a good quality of life, so we need to stop life support. After hearing those words from the doctors, what would you feel and how would you feel? How would you react? What decision will you make? Can doctors persistently push you to take your loved one off life support? The straight answer is no. It is very overwhelming to make a healthcare decision for a loved one if being asked, especially if they are in the course of being critical and can no longer make decisions on their own. It is even more difficult if you don't have a written or even verbal guidance or advanced care directive. In any case, if your loved one is critically ill in intensive care, you as the family can discuss with the medical team which approach you want for your loved one. That way, decision making for crucial life or death situations can be planned and get the kind of results as you and your family wishes and feel that your loved one would have wished for too. What does it mean to be on life support? Life support is usually deployed as a short-term, temporary measure to buy sufficient time for your loved one to recover from a critical illness and be able to sustain life without help of life support devices. There can be different forms of life support and all, multiple, or one of them may be deployed at one time, depending on your loved one's needs. The best known life support device is a mechanical ventilation machine which helps your loved one breathe when the lung is too sick to function on its own or when your loved one is in too deep of a coma to effectively breathe. Other life support methods include certain drugs like inotropes and vasopressors that may artificially keep the blood pressure elevated, keep it from dropping to zero, or keep the heart pumping adequately. Even in some severe disease conditions, emergent hemodialysis, the usual form of kidney dialysis used to clean the blood of toxins, can be a sort of life support tool. Then there are more advanced and complex life support machines that bypass the lungs and the heart and take over these organ core functions. This sort of life support device is known as ECMO or extracorporeal membrane oxygenation. There are many other therapies and techniques that may be used by clinicians to achieve the goal of sustaining lives. Other examples include feeding tube, total parenteral nutrition, also known as TPN, mechanical ventilation we already talked about, heart or lung bypass again, which is similar to ECMO, urinary catheterization, dialysis, CPR or cardiopulmonary resuscitation, then defibrillation, artificial pacemaker, use of inotropes and vasopressors. Next, Reasons why the medical team in intensive care wants to stop life support. Let's break this down. Number one, life support may not be working. The intensive care team and the medical doctors believe that your loved ones who are very sick don't respond to treatment. Despite powerful medicines, inotropes or vasopressors, and despite life support machines, your loved one may be getting sicker and sicker. Doctors and nurses caring for your loved one may recognize that there are no more life-saving treatments that can be used and tried. Number two, life support may not be able to save your loved one for very long. So sometimes life support may be able to keep your loved one alive for a period of time, but cannot cure them of a very serious underlying condition. Your loved one's health condition means that if they survive now, it will only be for a relatively short time, perhaps weeks or months. For example, this might be because your loved one has a form of cancer that hasn't responded to treatment, or it might be because their lungs are much damaged. Number three, treatment does more harm than good because of side effects. Medical teams believes that life-saving treatments can have side effects. For example, having a breathing tube in your mouth can be very uncomfortable and can make people feel as if they are choking. Tests and procedures in intensive care can mean many needles and catheters for a patient. If life-saving treatment would be very unpleasant for your loved one and would not bring a great benefit to them, it would sometimes not be the right thing to do for them. Let's look at some examples. Let's look at scenario A. A patient has a chronic disease like a terminal cancer that is becoming less responsive to treatment. It can also be a patient with a chronic ailment that cannot be cured, only treated, and the treatments are less effective and causing more harm and are very unpleasant for a patient. Old age fits as well into this category. The physician usually starts having conversations with the patient or the family or both while the patient is still aware and alert enough to make decisions about their long-term care. This is where living wills or advanced care directives and other documents come into play that describe how the patient wants to live until they die. Number 4. Life support is usually stopped when death is felt to be inevitable despite continued treatment. This would typically be when dysfunction in 3 or more organ systems persists or worsens despite active treatment, or in cases such as multiple organ failure. Stopping life support or withdrawal of treatment is an issue in intensive care medicine because it is now possible to maintain life for long periods without any hope of recovery. Intensive care is usually a process of supporting organ systems, but it doesn't necessarily offer a cure. Prolonging the process of dying is not in your loved one's best interest sometimes. However, withdrawal of treatment does not equate with withdrawal of care. Care to ensure the comfort of a critically ill patient is as important as the preceding attempts to achieve cure. Let's now look at scenario B. A patient had a cardiac arrest, survives CPR, but remains unconscious and loses the ability to breathe on his own. In this case, life-saving treatments are often continued until the patient shows improvement or meets the diagnosis of brain death. Unfortunately, the patient remains unconscious on a ventilator or, at the minimum, with a tracheostomy to maintain an airway, needing intervention to maintain bodily functions and unable to respond to their environment. The physician initiates conversations with the family early on in this patient's course about what life-prolonging measures they want their loved one to endure to treat the complications he is sure to have, because they think these patients frequently have very little brain function left, but more measurable activity then would meet the criteria for brain death, but they have very little chance for any sort of meaningful recovery. So those are some scenarios, and I have also written extensively what a meaningful recovery means in intensive care for your information. I've written about this and made videos about this in the past. You can look on our blog intensivecarehotline.com, and you can type into the search function meaningful recovery in intensive care, and you get more information there. So let's look at the next sort of situation, and it's also the situation where most families in intensive care come to us, and the situation is reasons why you should refuse taking your loved one off life support. So let's look at this. Number one, increase the chances of survival. When your loved one is brain dead or no longer conscious, the decision to initiate life support falls on the hands of the surrogates, family or relatives. Most of the time, the decision to put someone on life support revolves around the idea that your loved one is given the chance to live longer or recover fully, which means that denying them the treatment would be equivalent to killing them. The extended time frame that the life-sustaining treatment provides allows the family to have hope or come to terms with a traumatic event, accepts the situation and have more time to grieve. This also gives doctors a chance to continue to evaluate your loved one and provide newly discovered treatment if there is any. There have been cases where your loved one fully recovers after being put on life support. Nonetheless, the time given for the family to hope and for your loved one to survive is invaluable. Number two, you should refuse because it grants patients' wishes. Some people who have written a living will or an advanced care directive usually specify their expressed wishes to be allowed to fight every minute of their illness, regardless of the pain and suffering that they go through. Even when a similar request is given verbally, it is the surrogate's duty to carry out a patient's wish. Next, what do doctors mean when they say futile medical treatment? Because that often comes up when the issue is being brought up about removing life support. You can't be really talking about removing life support without talking about futility of treatment or clarifying the definition of futility of treatment. So doctors in intensive care may use the word futile to describe treatment that they feel should not be provided because it's very unlikely to work. Futile treatment means it is of no perceived benefit for a patient. Remember, it is of no perceived benefit. What's your perception? You have your own, and you're entitled to your own perception. So all medical treatment has a goal or an aim. For example, the goal of an antibiotic is to treat an infection. The goal of blood pressure tablets is to prevent your loved one from having heart problems or a stroke. There has to be a good reason to use medical treatment, otherwise doctors would not use it. Sometimes doctors identify that a treatment can't achieve its goal. The doctor will then usually decide not to provide that treatment. To use the same example, antibiotics don't have any effect on virus infections, only on bacteria. If the doctor is sure that your loved one doesn't have a bacterial infection, there is no point in providing antibiotics. Antibiotics cannot cure a virus. They cannot achieve their goal of fixing the infection. It's the same for life support treatment. The aim of life support treatment is to keep your loved one alive. The bigger aim is to help your loved one get through their illness and back to as normal life as possible, as quickly as possible. If it seems like life support treatment can't actually keep your loved one alive or can't get them through their illness, doctors may feel that there is no point in providing that treatment. There are different words that are used to describe treatment in this situation. Treatment might be called futile, inappropriate, not beneficial, not indicated. The usual reason that doctors call treatment futile is because it is not working or it's not going to work in their perception. It is like a culture in ICU where the doctors are often overtly negative when it comes to the condition of your critically ill loved one. But despite all these, you can keep being positive by telling them straight what you really want for your loved one. Next, we can't talk about can doctors remove life support without your consent, without looking at the management of perceived limited resources in intensive care. So the provision of critical care and intensive care is complex, regardless of location. Interdisciplinary team-based care with high technology monitoring and interventions will invariably generate high costs, including costs associated with capital equipment and consumables, salaries for nurses, doctors, other allied health personnel and physicians, and health system costs for long-term survivors. While you and your family are looking for the best therapy, care and treatment available for your loved one to maximize their chances of survival, the intensive care teams are looking at these situations that sets off their alarm bells as it relates to A, not wanting to spend too much money, staff and equipment resources to maximize their financial benefit. At the end of the day, healthcare organizations are all businesses, including non-for-profit organizations. B, not wanting to deal with a family that is quote-unquote difficult and demanding, and not wanting to invest too many emotions as well as efforts in dealing with you and your family, especially if you are perceived as quote-unquote difficult and demanding. C, intensive care teams want to stay in control of the treatment, therapy and care options. D, wanting to stay in control of the positioning of your critically ill loved one's diagnosis, prognosis, as well as the care and the treatment. Let me repeat this because this is so important. Wanting to stay in control of the positioning of your critically ill loved one's diagnosis, prognosis, as well as the care and treatment. So the question here is, what is your positioning? Because your positioning is just as important. And again, with help from us, for example, Intensive Care Hotline, we can help you advocate and consult you in those situations to get the best care and treatment for your loved one. And then next, E, they also want to stay in control of the meaning of your critically ill loved one's stay in intensive care. Remember, I was talking about a meaningful recovery a moment ago, and what meaning does this situation have for you? It's probably completely different to the meaning to an intensive care team, because intensive care teams are desensitized. They see situations like your loved one's situation 365 days of the year. They're very desensitized to what you are going through. And then last but not least, F, wanting to stay in control of who and for how long a critically ill patient is occupying a precious, scarce, expensive and in-demand intensive care bed. So when is enough really enough? The principle behind withholding and withdrawal of life support states that treatment may not be initiated if your loved one or surrogate refuses. There have been cases, however, when physicians suggest for treatment to be withdrawn, but your loved one surrogates can strongly argue against it. In general, everywhere your loved one can assign medical power of attorney to someone to make the choice for them if your loved one is critically ill and unable to make any decision. It is important, of course, to make sure that the medical team are aware of your and your loved one's standards concerning quality of life and that they need to respect those wishes. And also, furthermore, it doesn't matter whether it's in intensive care or it doesn't matter whether you're in the United States, in Canada, in the UK, in Australia, New Zealand, Ireland, South Africa, anywhere over the world. Really, intensive care units have policies around end-of-life treatment or withdrawal of treatment situations, and those policies state that you need to give consent. And it's the same in many states around the world, not only countries, but I'm talking about individual states, whether that's in America, whether it's in Canada, United Kingdom, Australia. There are state laws that usually state that families have to give consent before treatment can be withdrawn. And again, we have helped dozens, if not hundreds of families to achieve that goal by reminding them of their rights. You have rights and you need to exercise them. Intensive care teams often imply that they're operating in a vacuum and that they can make life or death decisions without asking you, or let alone asking for your consent. And that is simply inaccurate, as we have shown many, many times. And again, I've worked in the industry for over 20 years, and I have seen it for myself as a bedside nurse. Even nurses and doctors, including myself, have advocated for patients to not have life support to be withdrawn, because we know patients' and families' rights. And again, intensive care teams often pretend that they're operating in a vacuum and that they can make life or death decision at the drop of a hat, and they simply can't, because they do not operate in a vacuum, and they do have to adhere to policies and procedures. We have also put some references below this video in the written version of this blog, so you can see where some of the information is coming from. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, real power, real control, and how can you get influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site intensivecaresupport.org for families of critically ill patients in intensive care. You can also call me, find phone numbers on the top of the website. Also, have a look at our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one consulting and advocacy with me over the phone, via Skype and via email by clicking on the relevant tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll talk to you in a few days.